During my short trip in Vienna, I received an avalanche of email messages, direct messages, and carrier pigeons, all bearing the same tantalizing piece of news. Narcissistic personality disorder has been finally cured. There is a medicine, there's a panacea, there's a way to reverse narcissistic personality disorder, get rid of it, cleanse the patient, and render the patient wholesome, happy, functional. So that's the end of the saga, and we have to revise thousands of videos, textbooks, case studies, research notes, and articles to say that NPD is now curable. Believe me, kids and kidettes, there is no person on earth who wishes this to be true more than I do. Absolutely. I want this to be true. I want someone to develop a treatment modality which would convincingly, rigorously, and demonstrably reverse the course of narcissistic personality disorder and get rid of it once and for all, this cancer of the soul. So I dropped everything I was doing and immediately rushed to download this newly published article, which describes what is known as exploratory study. And I delved deep into it, as you're about to see. And unfortunately, I've been disabused of the good news. This gospel is wrong. No, there is still no cure for narcissistic personality disorder. And the study itself is highly flawed, embarrassingly so. It is a cringe-worthy pseudo-study. I'm going to eviscerate it now, analyze it if you wish. And I'm sorry to say, but this kind of wannabe studies, would-be studies, quasi-studies, pseudo-studies, they are the evidence, they are a testimony to the lamentable state of the pseudoscience known as psychology. And they are the reason why more than 80% of all studies in psychology cannot be replicated. The standards and benchmarks, including methodology, are so low, so compromised. And so analyzing this study carries a double benefit. First of all, to refute completely the claim, which is more than implied in the study, refute completely the claim that narcissistic personality disorder is treatable. Not only curable, forget about it, not only narcissists cannot heal, but it's not even treatable. And the second benefit is to demonstrate the state of the discipline, the state of the profession nowadays. When people pursue 15 minutes of fame at the expense of what appears to be a lack of professional integrity. And so, without further ado, let's delve right in. My name is Sam Vaknin. I'm the author of Malignant Self-Love, Narcissism Revisited. I teach psychology in Cambridge, United Kingdom, in the Commonwealth Institute of Advanced Professional Studies. I teach psychology in other universities as well throughout the thriving continent of Europe. And so, let's have a look at this article which has steered so many people, myself included. The article is authored by Igor Weinberg, Elsa Ronningstam, Gunderson, John Gunderson, and others. It is titled, Can Patients with Narcissistic Personality Disorder Change? A Case Series. It was published in the Journal of Nervous and Mental Disease recently, in July 2024. Now, just to be clear, Ronningstam and Gunderson are leading scholars on narcissism. They are pioneers in more than one way. But the study to which they have lent their name mysteriously and embarrassingly, the study is flawed. One thing the study does, it flatters Ronningstam and Gunderson. It fawns on Ronningstam and Gunderson by constantly citing their work. I have counted more than 20 citations of Ronningstam and an equal number, almost equal number, of Gunderson. Now, they are both eminent scholars, but they are human beings. And evidently, they are not immune to flattery. And so they've lent their names to this study. To start with, the study deals with 8 patients. Yes, you've heard me correctly. 8, like 1, 2, 3, 4, 6, 7, 8. 8 patients. 8 patients is a joke. It is impossible to establish any meaningful statistical significance with 8 people. It's impossible to normatively validate 8 people. In other words, all the statistical facade and all the statistical instruments that allegedly were used in this study were actually abused. Because when you deal with 8 data points, or with 8 clusters of data, it is meaningless to try to derive statistical significance or to say anything meaningful statistically. And so, anyone who is reading this article, anyone who is perusing this study, my advice is ignore all the statistical machinery. It is no more than a facade, and it doesn't bear even the remotest resemblance to a rigorous application of statistics to the study of the human mind, aka psychology. Not only is the number small, vanishingly small, 8 people, 4 men, 4 women, but the method of selection of this sample is nothing short of shocking. The clinicians who were working with these 8 patients, they were the ones who selected these patients. They were the ones who evaluated these patients. Do you hear what I'm saying? The study was intended to ascertain whether certain treatment modalities applied over a long period of time had a beneficial impact on a narcissistic personality disorder diagnosis and on the functioning of these patients. But who was chosen? Who led the study? Who chose the patients, selected the patients, and who evaluated the patients? The very people who have administered the treatment. It's like there's a medical doctor, and the medical doctor administers medication or performs surgery. And then we ask the very same doctor to evaluate the efficacy of the treatment. This is never done, period. This is never done. It's a major mortal sin. It's study design 101. When you're trying to evaluate someone's performance, you don't ask that very same person to evaluate their performance. It's exactly what this study does. This study asked the clinicians to evaluate the efficacy of their own treatments with patients they have selected for the study. This is mind-boggling. I don't have words to describe this flawed methodology, and by using the word flawed, I'm being uncharacteristically charitable and restrained. Of course, these clinicians, these therapists, these social workers, these psychiatrists, these psychologists, of course they would say that the treatments have been an astounding success, of course. Because if the treatment is a success, it reflects well on their own miraculous professionalism. What do you expect these people to say? The treatment has been a failure? I'm a failure as a professional? This is a joke. This study is a joke. Absolute joke. I am shocked that people of the caliber of Ronningstam and Gunderson have lent their names to this. This is shocking. and a testament to the deterioration of the field, to the decadence and decay of the field. If you want to evaluate the efficacy of treatment modalities or the application of multimodal treatments on patients, you ask for someone from the outside to make this evaluation. You don't ask the very people who administer the treatment to evaluate the treatment, and you definitely don't allow them to choose the patients who would participate in the treatment, because they would select only the patients with whom they've had a modicum of success. The authors admit that the clinicians selected only patients who have improved. This is written in the study. The researchers, the authors of the study say, yeah, it's true. These clinicians have chosen only patients who have improved, never patients who haven't improved. So it was what we call sampling or selection bias. The clinicians who actually formed the backbone of this study, they were highly motivated and incentivized to falsify the clinical picture, falsify the data in the study, not directly, but indirectly, by choosing only patients whose treatment has been judged to be a success and ignoring all the patients whose treatment was an abysmal failure. Now, we have no idea what are the ratios. We have no idea whether for every patient who has been a success, there are 1,000 patients who have not been a success. We have no idea whether the ratio is one on one or 1 on 1,000. We don't have this data. So we can't tell. It means that the results cannot be generalized to the general NPD population. If we were given the full set of data in the study, which we are not deliberately so, but if we were given the full set of data, for example, if the authors told us there was a group of 1,000 patients with narcissistic personality disorder, and of these 8 patients have improved, then we would be able to use statistical methods to generalize this, to project this on a bigger population or on the total population of people with narcissistic personality disorder. But we are not given this information. And I don't think it's an omission. I think it's deliberate, actually. And that's not okay. And again, I'm being charitable. That is absolutely not okay. And I'm using an understatement. And so the researchers say, the authors of the study say, don't worry. Yeah, we asked the clinicians to choose the patients, which is a no-no. And then we asked them to evaluate the efficacy of the treatment, which is beyond shocking. But don't worry about it, because we were there, the authors say. We also diagnosed these patients, administer to them various tests and so on. So we diagnosed them as well, not only the clinicians. And we followed up on the treatment. So we were there. But the researchers, the authors of the study, are even more biased than the clinicians in this case, because they started with a hypothesis. They started with a kind of theory, and the whole study is intended to justify this theory, this hypothesis, to find it valid, to validate it. So both the researchers and the clinicians are interested parties. They have an axe to grind. They're biased. This study is totally skewed, off the rails, completely biased, unreliable, and should be utterly ignored. It has not only contributed nothing, but it has polluted the discourse, in my view. And so mysteriously, of course, the diagnosis and observations of the researchers tally closely with this catastrophically skewed non-representative sample. Of course this is the case, because both the clinicians and the researchers want to substantiate the same outcome. They want to be able to say our treatments are efficacious. Also, there's a bit of self-enrichment here, self-interest, you know. If the treatment is efficacious, therapists and psychiatrists make a lot of money. So there's a money motive here. These people have every incentive in the world to present their treatments as efficient, to present the treatments as a cure, because then people will give them a lot of money. I can't begin to tell you how shocking this setup is to someone who is versed in scientific methodology. Yeah. On to the next problem. When you study a mental health condition, you need to study only people who have been diagnosed with this mental health condition and only with this mental health condition. So if you're studying people with narcissistic personality disorder, you need to study people who have been diagnosed with narcissistic personality disorder. In other words, they are not subclinical, but they're clinical. And you need to study people who do not have comorbidities, do not have other mental health issues. Because if you're studying someone with narcissistic personality disorder, who is also a borderline, who also has a mood disorder, he's depressive, for example, he has substance abuse disorder, and so on, then the picture is muddied, the picture is fuzzy, the picture is not clear. You can never isolate any event or any development. You can never isolate them and attribute them with any safety to a specific diagnosis. Imagine someone with narcissistic personality disorder and borderline personality disorder. This kind of person responds well to therapy. Which part is responding well? Is it the borderline personality disorder or is it the narcissistic personality disorder? We have no way of telling. We know that people with borderline personality disorder are much more responsive to treatment. We have dialectic behavior therapy, which is very powerful treatment modality in borderline personality disorder. And equally, we know that people with narcissistic personality disorder almost are non-responsive to treatment. But when you have a mixture in the same individual of borderline and narcissistic personality disorders, when this person is reacting well to treatment, there are good grounds to suspect that it is the borderline component that is reacting well to treatment, not the narcissism. And that's why we need, when you conduct this kind of study, exploratory or not exploratory. By saying that the study is exploratory, you do not exonerate yourself as a researcher. You're not exempt. Even exploratory studies need to adhere to to standards of rigorousness, and so on. So when you study narcissistic personality disorder, you need to study people whose only diagnosis is narcissistic personality disorder. However, in this particular study, 8 patients, mind you, the patients had 2 to 3 other comorbidities. The average was 2.5. 5 of these patients had mood disorder, including the extreme bipolar 2 disorder. Now, the manic phase of bipolar 2 disorder is indistinguishable from narcissistic personality disorder. Here, the contamination and adulteration of the data is profound. You should never study a patient who is concomitantly, where there is a co-occurrence of narcissistic personality disorder and bipolar disorder, because it's very difficult to tell whether the changes in behavior are attributable to the manic phase of bipolar or to the underlying narcissistic personality disorder. And yet, some of these patients, some of these 8 patients, had bipolar disorder. One of them actually had bipolar disorder. 3 of them were abusing substances, and we know that certain substances change the mind. For example, when you consume alcohol, there's a phase known as alcohol myopia, which is indistinguishable from pathological narcissism. So 3 of these patients were consuming alcohol and drugs. 3 of these patients had eating disorders. 1 of them had obsessive compulsive disorder. 4 of them were diagnosed with borderline personality disorder, and 1 of them was a psychopath diagnosed with antisocial personality disorder. And we know that psychopathy shares many clinical features and attributes with narcissistic personality disorder, for example, grandiosity. So we have a tiny sample, statistically insignificant sample of 8 patients. And none of these patients is a pure narcissist. They are all afflicted by 2 to 3 other diagnoses, all of which masquerade as narcissism: bipolar disorder, substance abuse disorder, mood disorder, antisocial personality disorder, borderline personality disorder. This is shocking. What on earth did these people study? What is this study all about? This has nothing to do with narcissism. They didn't study people with narcissistic personality disorder. They studied people with comorbidities. And they applied, when they diagnosed people, they used the Diagnostic Interview for Narcissism, DIN, and the Diagnostic Statistical Manual for Psychiatric Disorders, mental health disorders. They used the 5th edition. They use Section 2, however, in the 5th edition. Section 2 in the 5th edition of the DSM is copy-paste from the text from the DSM edition 4. So in the DSM-5, they copy-pasted text which was written 25 years ago and appeared in the 4th edition of the DSM. No one is using this anymore. This is outdated. This reflects totally obsolete clinical knowledge. It's a categorical approach, whereas today we use trait domain approach, for example, in the International Classification of Diseases, or we use a dimensional approach, for example, in the alternative model in the DSM-5. No one would construct a study around diagnostic criteria of narcissistic personality disorder, which were written in the 1990s, and, for example, do not acknowledge the existence of vulnerable narcissism. This is ridiculous. This is beginning to be funny. So here the study transitions from flawed to comic. Similarly, the Diagnostic Interview for Narcissism, which of course was authored by Gunderson, and that's why probably he lent his name to the study, because of self-aggrandizement, I assume. But the Diagnostic Interview for Narcissism was first compiled in the late 80s, was published in 1990. I'm sorry to say, I wouldn't use it if I were you. As a clinician, here's good advice: do not use it. I will dedicate a video to analyze several tests which are used in the diagnosis of narcissistic personality disorder, and I definitely do not recommend using the DIN. It's completely outdated. It does not sit well with the DSM-5 text revision. It absolutely has no correspondence whatsoever with the ICD edition 11. It's old, outdated, and completely obsolete. It reflects knowledge that has been debunked. It is focused on overt, grandiose narcissists, much more than vulnerable. Actually, there's no hint of vulnerable narcissism. It was good for its time. It was progress for its time. It contained, many elements and so on. But we are, 1990, we are 35 years later. So the authors used a 25-year-old text of diagnostic criteria and a 35-year-old diagnostic test. Seriously? You couldn't have used something a little more advanced, a little more accurate, a little more current, something that reflects contemporary clinical knowledge? Why did we default to these? Because of Gunderson. They wanted him on the paper. This is all politics, academic politics. which frequently contaminate and adulterate studies. The authors claim that most of these patients, 7 of them, have altered their behaviors. They began to relate to other people in a different way. They've changed their lives. In other words, they claim that there have been massive improvements in psychosocial functioning. There's absolutely nothing new about this. Everyone in the field knows that therapy leads to behavior modification in narcissists, that we can modify the behaviors of narcissists, abrasive behaviors, antisocial behaviors. We can also modify the way narcissists relate to other people, how pleasant they are to be with, and so on and so forth. There's absolutely nothing new in this. And so yes, psychosocial functioning, behaviors can be affected, impacted by a variety of therapies and treatment modalities. The problem is the remission or the remittance rate. Once time passes, the narcissist tends to relapse and all the benefits of the therapy evaporate. We'll discuss this a bit later. One major problem with the 4th edition of the Diagnostic and Statistical Manual, the text of which has been copied verbatim into the DSM-5, one major problem is known as the polythetic problem. The polythetic problem is the following. There are 9 criteria, and if you meet 5 of these criteria, you can be diagnosed, should be diagnosed with narcissistic personality disorder. But there are 9. So if you meet criteria 1, 2, 3, 4, 5, and if you meet criteria 5, 6, 7, 8, 9, in both cases you will be diagnosed with narcissistic personality disorder, but there's only one common criterion. In other words, imagine two patients come to the same clinician. One of them satisfies criteria 1, 2, 3, 4, 5. The other one satisfies criteria 5, 6, 7, 8, 9. They're both diagnosed with narcissistic personality disorder, although they have almost nothing in common. The only thing they have in common is criterion 5. This is known as the polythetic problem. In the DSM-4 and the copy-pasted DSM-5, there is no differentiation between critical clinical functions without which narcissistic personality disorder should not be diagnosed. Critical clinical features such as a lack of empathy or lack of affective empathy, grandiosity, narcissistic supply, regulatory self-enhancement. These are critical features without which one should never diagnose narcissistic personality disorder. However, that is not the way that the text of the DSM is worded. The text of the DSM allows the clinician to diagnose someone with narcissistic personality disorder based on non-essential criteria such as exploitativeness, envy, entitlement. So this is a major flaw in the methodology of the Diagnostic and Statistical Manual, because there are clinical features, there are attributes, there are traits, trait domains, without which one should never ever be diagnosed with narcissism. And there are other clinical features, other behaviors, ways of relating to people, and so on, which are typical of narcissists, but are insufficient. They don't meet the threshold. They're subclinical. They don't allow us to diagnose with narcissistic personality disorder. The polythetic problem is one of the reasons that the text of the DSM, incorporated in the DSM-5, should never be used in research. Never. At least not section 2. This list of 9, bullet list of 9 diagnostic criteria should never be used in research, because it does not make a distinction between threshold conditions, sufficient and necessary conditions, and merely sufficient conditions. It doesn't make this distinction. So the criteria are muddled and highly problematic. And because there's no differentiation, the 8 patients are highly suspect. Maybe some of them are actually not narcissists, people who should not have been diagnosed with narcissistic personality disorder, but for example with a dark personality, subclinical narcissism. We don't know. And the picture is further obfuscated by the fact that all these people have had comorbidities which are indistinguishable from narcissistic personality disorder, other conditions, other mental health conditions, which are indistinguishable from narcissistic personality disorder. This is the methodology of selection, how you select a sample. So here in this study, there's extreme sampling bias and selection bias, and the wrong people, the wrong patients have been selected 100%, all of them, maybe with one exception, all of them. What about the design of the study? It is equally flawed and problematic. The study uses something called retroactive pretest post-test. It's a type of design of studies which is considered a seriously inferior, vulnerable, and problematic design because it makes it impossible to tell what is the etiology of any observed changes in the patient. In other words, this kind of study doesn't allow us to say this change is the result of this event, or this change is the result of this crisis in the patient's life, or this change is the result of therapy, a treatment modality, or the combination of treatment modalities, multimodal therapy. We can't say this. When the study is designed, when the design is retroactive pre-test, post-test, we are unable to trace the origin of changes in the patient's life, and the claim that these changes have to do with treatment or therapy, these claims are false and wrong. End of story. No mitigating statement, no ameliorating circumstances here. These are simply fallacious claims and statements. Life circumstances, events, crises, relationships, the passage of time, known as maturation, all of these have impacts on patients. Change them. People change over time. How can we tell that these changes have been brought on by these miraculous, newfangled treatment modalities? We can't, not with this kind of design of the study. And there is a foundational problem here. Pathological narcissism is about attempting to impress people, attempting to manipulate people, attempting to manage impressions. In other words, the patients who participated in the study and were diagnosed with narcissistic personality disorder definitely attempted to impress the researchers and the clinicians. They definitely attempted to manipulate the clinicians and the researchers. They definitely attempted to manage the impressions gained by the clinicians and the researchers. This is what narcissists do. You cannot rely on self-reporting by the narcissist. Everyone says that narcissism is about fantasy, delusionality, and confabulation. So how can you trust a narcissist to provide you with accurate reporting regarding their own internal states to which they have no access? This is complete nonsense, unmitigated nonsense, crazy nonsense, I would say, you know. And so there are threats to the internal validity of the study. The internal validity of the study is threatened, in my view, non-existent. How do we know that the changes observed in the patients, most of which, by the way, have to do with behavioral changes, like getting a job or finding a girlfriend, these kind of changes. Yeah? How do we know that these changes are the outcomes of therapy and not other factors or confounding factors? Well, you guessed it. The answer in the study is the clinicians who have administered the therapies assure us that this is the case, that these changes are the result of the therapy. So the very doctors, psychologists, psychiatrists, therapists, and social worker in one case, the very people who have been treating these patients, they give us their word and their guarantee that all the changes in the patients have to do with the treatment and with the therapy. And of course, we should believe them. They are not biased. They have no incentive to lie, for example, or to fabricate, or to exaggerate, or to maybe deceive themselves. They have no incentive to do any of these things. They're objective, unbiased observers of their own work. They don't want to feel successful. They don't want to self-aggrandize. They don't want to exaggerate their accomplishments. No way. They're superhuman. They're not human. And so if they're telling us that all these changes have to do with therapy and treatments, we should take their word for it, because they are the ones who have administered the therapy and treatment. This is a mockery of how a study should be designed. I am beyond shocked that people of the caliber of Gunderson and Ronningstam have lent their names to this. Beyond shocked. The very awareness of the people participating in this study, that they are participating in a study, this awareness, this self-consciousness that, hey, I am someone in a study, I'm being observed, I'm being analyzed, and so on. This affects the behaviors and responses of the narcissist, because narcissists constantly respond to these cues. They constantly manage impressions, they constantly manipulate, they are constantly trying to alter the consciousness of everyone around them and to drag them into a fantasy. In this case, the shared fantasy is treatment works, NPD can be cured. That's a shared fantasy of the researchers, the clinicians, and the narcissists, who have, in my opinion, manipulated all of them. The awareness that you're part of a study, the awareness of the expectations of the researchers and the clinicians would motivate the participating narcissists to alter their behaviors, to present a facade of change, to claim that they're undergoing transformative processes and events, so as to gratify the researchers and the clinicians and garner narcissistic supply. It's as simple as that. These people, the researchers and clinicians, have been manipulated by the narcissist in the study. I don't have the slightest doubt whatsoever, and they should look seriously into this. When the patients have been evaluated in the study, and again, to remind you, we're talking about 8 patients, not 8,000 patients, but 8 patients, all of which have been selected by the clinicians as the patients who have made it, ignoring completely the population of patients who failed abysmally and miserably. So it's a self-selecting, biased sample. How have these people been evaluated? The authors or the researchers use what is known as retrospective assessment. They evaluated the existence or the incidence, actually, of narcissistic personality disorder at baseline when the study started, and they evaluated the existence of narcissistic personality disorder post-treatment. On the face of it, this is a great way to determine whether there's been any kind of remission in the diagnostic criteria of narcissistic personality disorder. In other words, if you evaluate someone at the beginning of a study and then you evaluate the same person at the end of a study after years of treatment, and this person has changed in the sense that this person no longer meets certain diagnostic criteria, we can say that the diagnosis is gone and healing and a cure has been effected. However, when you use retrospective assessment to accomplish this, the results are null and void. Retrospective assessment is a useless tool because it involves recall bias, selection bias, difficulty in establishing causation, missing information. inability to generalize, a generalizability problem, confounding variables, undergeneration of hypotheses, temporal relationships, statistical limitations. For example, you cannot use incidence rate in this kind of retrospective assessment. So again, the tool chosen, and I admit that the researchers didn't have much choice. The tool chosen in this particular case gives no meaningful information about the diagnosis of these patients, about the longitudinal evolution of the disorder, and about any changes. And definitely, we cannot attribute any changes to the therapy. So even the diagnosis of these patients is highly suspect. The use of antiquated, obsolete texts, an antiquated, obsolete diagnostic test, and the use of retrospective assessment at baseline and post-treatment put together mean that these people, these patients, may have actually been misdiagnosed, or that the narcissistic personality disorder diagnosis is in the conjunction of a powerful, overpowering, overwhelming comorbidity. In other words, it's an adulterated, contaminated diagnosis, which can never, ever be used in research. The study authors of the study claim that the study is longitudinal because it has followed the patients for an average period of 2.5 to 5 years. By the way, the study didn't follow the patients. The clinicians followed the patients. So the authors of the study rely on the biased, self-serving, self-interested, and may I add, self-enriching reports of the clinicians. And then they call the study longitudinal because they have reports submitted by these clinicians and which cover a period of 2.5 to 5 years. I don't know how the authors got their PhDs. I find this equally shocking. Anyhow, the study is, of course, not longitudinal. A longitudinal study is a study that follows the patient, does not rely on reports by third parties, follows actually the patient for several years, sometimes decades. The authors of this study have not done this. They dived into a heap of documents compiled by people who have had every reason in the world to falsify the results, knowingly or unconsciously. So the patients have not been followed up, not during the treatment and not after the termination of therapy. Why is this important? Because we don't know what happens to these alleged changes after the therapy is terminated. For example, imagine that the treatment modality, the therapy, has induced some changes in a patient. And then the therapy is over, terminated, and the patient goes his own merry way. He now has a girlfriend, he has a job, he treats people nicely, and so on. How do we know how long these effects, these changes last? How do we know that the patient does not completely relapse after 6 months? How do we know that these narcissists who are allegedly, ostensibly altered, changed, transformed, transubstantiated almost by the treatment, miraculous treatment modalities administered by these impeccable high-class professionals, how do we know that these impacts of the treatment are not completely temporary and transient? We don't know, because there's been no follow-up of these patients after the treatment, after the therapies. No follow-up. It's not a longitudinal study. This claim in the study is completely fallacious, completely false. I said that I will dedicate a video to the DIN that was used and so on and so forth. So we'll let it go at this stage. I want to read to you a segment from the study to give voice to the authors. They say, clinical reports indicated that patients experiencing pathological narcissism, including NPD, present with such interpersonal problems as intrusiveness, dominance, and vindictiveness. They're quoting studies by Keeley and Ogrodnichuk. More specifically, say the authors, studies show that grandiose narcissism is associated with a triad of admiration, seeking rivalry, and retaliation, whereas vulnerable narcissism is associated with patterns of intrusion, coldness, and social avoidance. There's a mistake in the text, by the way. Covert narcissists are also grandiose. All narcissists are grandiose. What they call grandiose narcissism is overt narcissism. Okay. I'm continuing to read from the article. Pathological narcissism was found to be negatively associated with attachment security. That is, grandiose narcissism related to dismissive attachment, and vulnerable narcissism to fearful and preoccupied attachment. And they're quoting a variety of studies. In addition to attachment patterns, identity dysfunction and non-adaptive defense mechanisms also contribute to interpersonal problems in NPD patients. Various forms of psychotherapy were reported to improve interpersonal patterns. That is accurate. Behavior modification definitely can be induced by therapy. The authors continue to say such changes occur through a direct focus on interpersonal patterns or treatment relationships, or through changes in general personality functioning, including use of more adaptive defenses or a better consolidated sense of self. They're quoting Wachtel. In fact, studies confirm that one of the mechanisms of change in interpersonal functioning relates to changes in attachment style, as well as in mental representations of self and others. Such changes were reported in patients with borderline personality disorder, although in NPD patients, this question remains untested. That's the understatement of the year. This question is not untested. It's actually quite settled. In the present study, continue the authors, the results indicated a decrease in interpersonal problems during the study. And this is based, of course, on reports by the clinicians who have administered the therapy. And these reports are unreliable, biased. The authors continue to say, unflinchingly, individual cases demonstrated less interpersonal avoidance, less dismissiveness in interactions, less sensitivity to rejections, and better regulation of anger. And they're quoting inevitably Ronningstam. Although our sample was too small to permit analysis of these individual variables, these changes were likely contributors to improved interpersonal functioning at the end of the study. Given the fact that these patterns were also addressed in the case reports filed by the aforementioned clinicians, it is likely that these treatments, at least in part, have contributed to the improved interpersonal functioning observed in the study sample at the end of the treatment. This is all, by the way, taking a break here, it's all catastrophic, disastrously, methodologically flawed, as I've explained before. I continue to read from the article. Careful observations of the case reports highlighted the following putative factors that were likely contributed to change observed in the study. 1. Openness and motivation for change. 2. Interest and capacity for work or study. 3. Ability to stay in close and committed relationships. They're talking about narcissists, by the way. 4. Multimodal nature of the treatment. 5. Motivation for change stemming from co-occurring disorders such as borderline personality disorder. They're saying it. They're admitting that the comorbidity taints, contaminates the study. And they say motivation for change stemming from co-occurring disorders such as borderline personality disorder or motivation to maintain sobriety. Treatment factors, for example, treatment alliance, focus on emotions, reflective processing and experiences, as well as life events such as work, losses, achievements, relationships, synergistically contributed to change. No doubt. But what's the contribution of the treatments? Is it 5%? Is it 50%? Is it maybe 85%? We have no way of knowing. And so this invalidates the whole study. It's a meaningless study. Treatment, therapy, is a life event, exactly like divorce or falling in love or, it's a life event. So this study says life events affect change, create change. in narcissists? Well, we've known it. Of course they do. And one of these life events is therapy, say the authors. No kidding. But what's the contribution of therapy? This is what you were supposed to answer. You claim that therapy cures narcissism. Really? You haven't substantiated this. You haven't given us a single datum, you haven't given us data, nothing. There's nothing in this study. It's a totally vacuous study, non-study, vacuous non-study. When a single tiny study flies in the face of decades of research by hundreds of highly esteemed experts, something is seriously wrong, not with the decades of research, but with this tiny, ill-designed study. I want to read to you again from the article. Studies documented significant challenges, and I'm reading from the article now. Studies documented significant challenges in psychotherapies with NPD patients. 2/3 of NPD patients tend to leave treatment prematurely, and elevated ratings of pathological narcissism are associated with treatment dropout. Patients with NPD tend to evoke strong negative feelings in their therapies. Specifically, therapists of these patients report feeling disengaged, hostile, angry, criticized, devalued, helpless, inadequate, unsatisfied, negative, or worried, uninvolved. There's even a clinical term for it, by the way. It's called vicarious traumatization. Back to the article. These reactions in the therapist are hard to bear, and many times they lead to stalemates, treatment undermining the interventions, or precipitate treatment terminations. Dismissive attachment associated with NPD is also associated with weaker alliance, less treatment commitment, less self-disclosure, less time spent in sessions discussing treatment relevant themes, and longer pauses. Perfectionism, another characteristic of NPD patients, interferes with effective treatments. Shame, yet another feature of NPD, Morrison, they're quoting Morrison, is associated with a slower improvement in treatment, worse attendance, and lower treatment alliance. The evaluation of others was also reported to interfere with treatment progress. Anecdotally, comorbid NPD was associated with slower improvements in psychotherapy, although the statistical testing of these observations is lacking. These studies confirm the notion that treatments of NPD patients are challenging. I'm reading from the article. Several studies focusing on the stability or remission rate of the categorical diagnosis of personality disorders in DSM-3 and DSM-4 have pointed to the instability of narcissistic personality disorder symptoms and remittance of the NPD diagnosis over time. In other words, even when the patient somehow improves, this improvement is unstable, temporary, transient. The authors are quoting these studies, and then they say, pretty arrogantly in my view, everything that came before us should be ignored. We're opening a new chapter, a new period in history, based on 8 patients selected by their own clinicians, none of which is a pure narcissist, all of which are diagnosed with comorbidities. Wow, talk about grandiosity. The authors continue to say that their approach is superior to everything that's been done before, and they delineate a research agenda based on this approach. I'm sorry, I can't take this study seriously, never mind who are the authors. This is not a serious study. It doesn't give the slightest indication that narcissistic personality disorder can be cured or healed or even treated. It is hopelessly muddled, obfuscated, flawed. Its shortcomings are so profound that it should be completely discarded and ignored in the literature. So, regrettably, no, there's no breakthrough here. There's nothing here but a group of self-interested, clinicians, maybe self-deceiving clinicians, who report about a group of manipulative people, none of whom is a pure narcissist, by the way. And these reports are taken as raw material when they should never be. And then extreme conclusions are drawn with not the slightest hint of anything rigorous, with a catastrophically wrong methodology and no longitudinal follow-up. Yet another disappointment. I am looking for the study which would convince me that NPD is treatable, let alone curable. That day, I will celebrate. We all learn, we all evolve. Nothing stays the same. Knowledge, especially in science or disciplined thinking, new knowledge always revises and revolutionizes what you thought you knew. This is the fun, this is the wonderful aspect of science, that there's always something new. There's always progress. There's always evolution and revolution sometimes. This excitement, this thrill of the new, this is what drives academics forward. This is what keeps them in their fields. So I'm not committed to any position. I'm not committed to any statement. I'm not committed to anything. I'm committed to the facts. I go where the evidence leads. And if the evidence were to lead to the conclusion that NPD can be treated, I would be the first one to issue a video saying NPD can be treated. Guys, they are wonderful, exciting news. NPD now can be treated. There are new treatment modalities. There are new ways to treat people, maybe by combining therapies and so on. I'll be the first to say so. And if psychedelics could affect the cure, I'll be the first to celebrate this. It's not true simply. At this stage, NPD cannot be treated. And no, psychedelics don't cure NPD. And no, we don't have studies that show that NPD is genetic or hereditary, although in my personal opinion, it is. But personal opinion is not science. And so cool it. Science is slow. It's an inexorable glacial process. There are very rarely revolutions in science. And this is a major revolution. To claim that NPD is curable is a major revolution based on 8 pseudo-patients, so-called patients. Give me a break. This is a joke, simply a joke, and I'm not laughing.